The time right now is 2:32, and right now, Colorado's Health Department is speaking after the CDC announced relaxed mask-wearing guidelines for fully vaccinated people. Let's listen in live.
In Colorado, for the last 2 weeks or so, we have seen that clear decline in cases in the state, and this is certainly a great sign. And this decline appears to be occurring in all age groups at this point as well. So next slide, please. So this figure is showing you our age-specific trends in cases. And here we are comparing age trends in children that are in middle school or high school, adults, and then children that are in preschool year ages or elementary school. And what we can see looking at this figure is that our highest rates do continue to be among those middle school and high school students, followed by adults in the state, and then that preschool and elementary school age group. So again, the rates continue to be highest among middle and high school students, but across all age groups, we are seeing clear signs of improvement in our case trends right now. Next slide. Also, just in the last couple of days, we've started to see a downward trend in hospitalizations in the state as well. We know that hospitalization trends can lag behind case trends. Often it takes 1 or 2 weeks or even longer for us to start to see a decline in hospitalizations following a decline in cases. So it's really just the last couple of days now that we've started to see a clearer sign that hospitalizations appear to also be decreasing in the state. So overall, we are seeing an improving picture in Colorado as far as our case trends and our hospitalization trends. And with that, I'll hand it over to Dr. France. Thank you.
Thank you, Dr. Hurley, and good afternoon, everybody. It's a good week for vaccines. Great news that the Pfizer vaccine has now been approved for children ages 12 to 15 years of age. This should quickly get us back to a more normal life for our children and students. We know today in Colorado that the highest case rates are among persons 11 to 17. And so being able to vaccinate these folks will certainly help control our spread, get students back into camps, back into school, and return us all to a life of normalcy. This Pfizer vaccine is now allowed to be used through emergency use authorization, or EUA, and it's based on studies that were done that are called bridging studies. And these are typically done as part of the scientific approach and design to new vaccinations. There must always be a first very large trial, like we had with all 3 of our current vaccines, in which the efficacy of the vaccine and the safety of the vaccine is heavily studied, so that you know that biologically this vaccine produces protection and reduces cases. Once that has been established, we then start looking at where else can these be expanded. And so, of course, the first place here now is with children. Bridging studies were done. They started last July, involved almost 2,300 children, randomly assigned to receive the vaccine or placebo. And like other studies, the safety was reviewed, looking for any serious adverse events or common adverse events, as well as having a look at how well the vaccine actually protected children. Those who received the vaccine, the 1,100 some children, had no cases of COVID, whereas there were 18 in the control arm. And there were no signs of any serious adverse events. The common side effects, such as headache and fever, swelling, arm pain, all of that mimicked what we see in older groups. So it's great news, and I know even today we've started vaccinating children 12 to 15. Next slide, please. I think as we've been moving forward with our vaccine efforts, we still hear that there are folks who have questions about how vaccines work and how do they provide protection. And so as our press partners, I'd certainly ask you to continuously educate your readership, your listeners, your viewers about how vaccines work to help clear up any questions they have. And of course, you'll all remember that vaccine science really started 100 plus years ago when we recognized that if you take just a piece of the bacteria or the virus, like the protein on the outside of it, and you introduce it into the body, that protein would be seen as foreign by your immune cells, and your immune cells would then build protection against that protein. So that in a future day, when you actually were infected by that bacteria or that virus, your body's immune system was primed and ready for the fight and could quickly defeat that infection. For COVID, of course, we see more than a 92% reduction in cases thanks to the body's immune system fighting off this infection. What's unique about our current vaccines is that rather than providing the body's immune system with the finished protein, instead, we present the body with a recipe or a blueprint from which the body can then read and build its own version of that virus protein. So messenger RNA serves as that recipe, and the body looks and follows the steps of the recipe to build a spike protein from COVID. It then presents that protein to the cell's immune system and the body's immune system. And by doing so, it prepares the immune system for some future date when we are actually infected by the virus, our body's immune system is ready and can quickly defeat it, preventing us from getting sick. As you can see, we have 3 different kinds of vaccines. 2 of them use a recipe made by messenger RNA, and the third uses a viral vector, the J&J vaccine, that is translated, read as blueprint to create the protein that's presented to the body. What we've learned through all of this, because of the careful scientific methods and approaches used, is that these vaccines are very, very effective and very safe. And with that, I'll turn it over to Kate for updates on vaccination in our state. Thank you.
Thank you, Dr. France. And like he mentioned, it is a big day for all of our providers and our community vaccination sites across the state. They've been preparing for the potential approval of the vaccine for the 12 to 15-year-olds. And as a result, they were able to start doing the administration of the vaccine with 12 to 15-year-olds today. So in addition, we just recently hit the 5 million doses administered mark, as you can see on the slide. That's 5,078,256. And I just want to make note that that is a little bit different from what you might see on the public-facing dashboard. And that's because that includes the federal doses administered. So we added that number to the number that you can see on the public-facing dashboard to get there. And another change to note is because we just opened up the eligibility to the 12 to 15-year-olds, that changed our baseline number that we've been using to calculate our percent of vaccinated across the state. So yesterday, our calculations showed us close to 49% fully vaccinated, but with the addition of the estimated 300,000 or so eligible 12 to 15-year-olds across the state, our percent fully vaccinated in Colorado is now showing 47%. So that explains that slight dip. So as of today, we also show that over 35% of the 16 to 19-year-old population across the state has received at least 1 dose. We have consistently ordered all of the doses available to us. We've got a robust plan to continue vaccinating everyone that would like the vaccine across the state as quickly as possible. And as you've noted, our demand has fluctuated. And we have ample supply to be able to accommodate those fluctuations in demand. We have now more than 1,400 providers enrolled. We continue to enroll more providers across the state to administer the vaccine. And we're working with them to ensure folks all across the state know how to schedule an appointment and make that as easy as possible. I just want to take a second to talk about, vaccines and their expiration date. Since our supply is plentiful right now, we are really tracking our doses across the state. and moving vaccine as we need between providers to make sure that we're getting those used in a timely manner. While we want to continue to follow the best practices to use every dose possible, we also want to make sure that doesn't come at the expense of missing an opportunity to vaccinate every eligible person when they are ready to get vaccinated. So you can find all kinds more data about the vaccines administered statewide and by county on our vaccine dashboard. And you can find that information by clicking vaccine administration and then choosing all vaccines. So next slide, please. So we are really heavily focused on community-based vaccination events all across the state to get all Coloradans vaccinated, including the 12 to 15-year-old population. We have a wide-reaching mobile vaccination program making stops all across the state and a robust equity effort that has hosted over 900 clinics to date across the state. You can find more information about where the mobile buses are stopping on our website as well. With regard to school-aged vaccinations, we are working with our local public health agencies. They're really leading the effort to vaccinate across this age group with the school-aged age group. And the state's working closely with all of our local public health agencies, and we're ready to help if any school district does need assistance or any local public health authority requests assistance from us. So we also just launched a workplace vaccination program, and employers, unions, and trade associations can enroll in this program to provide their workers on-site vaccination opportunities. That just launched yesterday on our website, and we're already scheduling based on some of the requests we've received. Employers can find more information on the state's COVID website as well, and then our 1-877-CO-VAX CO number is listed there as a reminder. Next slide, please. So in addition to all the programs that I just mentioned, our community vaccination sites are all still running. You can see details on the slide about the days of the week and the times that those sites are open. And then I want to note that every site, aside from Pueblo, has all three kinds of the vaccine available. Pueblo is run by our partnership with FEMA, and they have the Pfizer vaccine primarily available. That does change a little bit. They do have a very small amount of the Johnson & Johnson vaccine, but I didn't list that on the slide since it is such a small amount. So, but all of the other sites have all three types, and they all have appointments available as of this press conference, and people can go online and register, or they can easily just walk up to the site. And again, they are all now serving the 12 to 15-year-old age group with the parental consent. So that's all I have. Thank you so much.
Great, thank you. And thank you everyone for participating. We're going to now go to the Q&A portion. We'll use the raise hand function. And if you could say your name and the outlet that you're with, I definitely want to take all first questions first so that we can get to as many of you as possible before we go on to follow-up questions or multi-questions. And then I'm going to go ahead and start with John Daly. I believe that you couldn't find your raise hand, so let's start with you.
Can you hear me okay?
Yeah, perfect.
Okay, great. This is a question, I think, for Dr. Hurley and Dr. France. I wanted to see what you thought about the CDC and the updated mask guidance today about essentially if you're vaccinated, you don't need to wear a mask, and that includes indoors, except for certain types of situations. Just wanted to get your take on that, and what does this mean for Colorado? How should Coloradans proceed now with this latest information?
Good question, John. And of course, we were expecting it. And I'd say that Rachel and I think have been in back-to-back Zoom meetings since that actually came out. So we haven't had a chance really to review it. I will say the state in general will be reviewing this and looking at how it impacts our own mask guidelines, but it's too early to say anything just yet.
Great, thank you. John Frank.
Yes, hi, this is John Frank at Axios Denver. I'm wondering if Dr. France, if you're concerned about the localities in the Denver area moving to level clear this weekend, and do you have any data to indicate what to expect in terms of the numbers as these restrictions lift? Thank you.
I don't know that I have detailed numbers as these restrictions are lifted. I am heartened by the data that Dr. Hurley shares with us every day that shows for the last 2 weeks our cases have been going down. And now, not surprisingly, hospitalizations too are going down. So clearly, this virus is still in our community. And clearly, the best way to be protected is by transmission control techniques like staying 6 feet apart and wearing a mask. We'll have to see how the CDC sees this new recommendation. But I would say every Coloradan should assess their level of comfort with the potential risk of still being exposed. And certainly those who are unvaccinated should think twice about being in an indoor setting where we know spread is higher, and consider where their risks potentially are. We do expect that over the summer months that the numbers will be coming down, and this may turn into something more of a seasonal illness with numbers coming back up in the fall. That might give us a bit of a break over the summer months. But I'm hopeful that with the numbers coming down, any risks from going to the next level on the dial are small.
Great, thank you. Meg.
Hello, this is Meg Wingeter from the Denver Post. Can you hear me all right?
Yes, we can.
Thank goodness. All right. My question is about, the governor had talked about by the that hopefully everybody who wanted a vaccine would have had one. And with adding the younger teens to the mix, and also that the pace of vaccinations has slowed down a bit, has anything changed about that timeline?
Meg, I'm sorry, I missed the first part of the question. You did break up a little bit.
Okay. So I started with about the governor had said that the idea was by the end of May, everybody who wanted a vaccine would have had the chance to get one. So I wondered, with including the younger teens now and all new vaccinations slowing down, if that timeline was being adjusted at all.
Well, I will say that it was likely set with the understanding of 16 and above for that, and that we've hit that mark in the sense that anybody who wants to be vaccinated who is 16 and above and now 12 and above can be vaccinated. The course of vaccine acceptance and uptake in this community over the last 5 months is actually very similar to other vaccines. We have a hyper focus now on the COVID vaccine, but if you looked at 1995 and the introduction of the chickenpox vaccine, or in 2000 or 1997, I think it was, the HPV vaccine, each vaccine has a very similar approach where there's some people who are very interested from the get-go. They've had friends who've had the disease and they jump on the vaccine. There's a big group of people who get it right away, and then there's another group that gets it as it becomes more available, convenient, and after they've talked with their doctors about it. And this vaccine is really no different in how it's playing out. So truly, by the end of May, we are at a place where anybody 16 and over who wants to be vaccinated can be vaccinated, and now anyone over 12 can as well.
Thank you.
Great, thank you. Alan.
Thank you very much. I think I have it working. Do I?
Yes, you do.
Okay, great. Thanks so much. Let me ask the cynics question, Dr. France and Dr. Hurley. A lot of people through the pandemic have said, we have to follow the science, follow the science, follow the science. Well, the CDC came out today and said the science indicates, based on studies in Israel of vaccinated healthcare workers and otherwise, that we should peel back the mask mandate. Why not immediately go with what the CDC says and peel it right back?
Again, Dr. Hurley, I haven't had a chance really to review what the CD has actually said. My apologies for not being prepared for that today. I would imagine there's always both science and what people are personally comfortable with that will also play into it. So persons may still wear masks when the science says they may not need it because they personally feel that that would be the best way to protect themselves and their loved ones. So I'm certain that after we have a chance to review this, we'll look at how it impacts our own Colorado mask recommendations.
Is there any timeline?
I'm sure it'll be within the coming days.
Mhm.
And
Great,
Dr. Hurley, I'll just double check to see if there's anything you'd add.
And then the only thing that I think that I would add there is that, keep in mind that what I've been able to see so far from CDC specifically is applying to individuals that are fully vaccinated. And we know that there's obviously a portion of our adult population that is not yet fully vaccinated, and fully vaccinated means 2 weeks out from that second dose. So a reminder to folks that, that guidance applies to 2 weeks after being fully vaccinated, at least what CDC has put out so far. And then I think it's also important and we've said this previously, for parents to recognize that, while the vaccine is now more readily available for younger children, so down to age 12, there are still going to continue to be many children that aren't fully vaccinated for quite a while, whether those are 12 to 15-year-olds that are just getting started now and getting vaccinated, or children that are younger that are still not eligible for vaccine. And it continues to be important for, parents to recognize the importance of the fact that those kids continue to be susceptible.
Conversely, a lot of people have talked about why wouldn't the state set up a framework to show who has been vaccinated, like a vaccine passport, which would allow them greater access? Is there logic there?
Alan, I don't mean to cut you off, but I really want to get through as many first questions as possible. So
Gotcha.
if we can get to your second one, we will. If not, you can go ahead and send that over to me via _info@state.co.us. And so Anusha, you're next.
This is Anusha with 9 News. Wanted to touch base on the vaccine rates slowing down as well. And what kind of pace would we need to pick back up to be able to reach herd immunity and outpace the variants?
Yeah, this is Rachel. So it's a challenging question. It's certainly a very good question, and a question that we are eagerly trying to answer. I think, unfortunately, it's pretty complex in trying to understand what the herd immunity threshold is, and then trying to understand what proportion of our population is immune, and trying to forecast then when we are going to reach a herd immunity threshold. So there's moving targets here. We have a virus that has evolved over time and become more transmissible. So when that happens, that herd immunity level changes because the basic reproductive number, that R value associated with the virus, changes. And so that really changes what we think the herd immunity threshold would be. At the same time, we have individuals that are rapidly becoming immune as we bring on vaccine, but we know that there's also some element of waning immunity following infection. And so we have to potentially subtract out those individuals. So there's really a lot of moving pieces here in trying to precisely understand when we could reach herd immunity. I've said previously that I do feel that Colorado has a decent shot at reaching herd immunity. I know there's been a lot of national conversations about that recently, but based on survey data and comparing data in Colorado and the proportion of individuals that have been fully vaccinated or want to be fully vaccinated, we know that Colorado is doing well. And so there is that potential to reach that threshold, but it's going to be challenging for sure. And we do need to continue to see, high vaccination rates occurring across the state. Some work that our modeling team has done has suggested that sometime this summer we could potentially reach one of those lower level thresholds, that 70% range, if we continue to see high vaccination uptake. But again, we don't know precisely what that threshold is. I think the key message here is that the more individuals that are vaccinated now, the better position that we are going to be in going into the fall and that typical respiratory illness season, when we could see, the COVID-19 virus transmitted just alongside flu and other respiratory viruses that typically happen in fall and winter.
Great, thank you. Chris.
You've been listening to the Colorado Health Department giving an update on our state's response to COVID-19. CDPHE's Chief Medical Officer, Dr.
Chris, we're kind of...
Sorry, Chris, we can't quite hear your question.
Yeah.
It sounds like Darth Vader speaking.
Is this better? I bet this is better.
Oh, yes, perfect.
Sorry, guys. It's like this many months into this, you think I would learn this thing. Okay. So I want to ask a question in regards to, we've now expanded the pool to people eligible to get the vaccine for 12 and 15-year-olds, which now raises the question that potentially if a child between the age of 12 and 18, a teenager wants to get vaccinated and their parent says no, is there any way for that teenager to still get vaccinated, or are they all still dependent upon their parent giving the permission to parents who may be anti-vaccine?
Yeah, it's a good question. I think it varies by state. And in our state, parental consent is required for vaccination. We'll often see in pediatric clinics a 15-year-old come in for a sports physical without their parent, and the office can call them and talk to the parent and get verbal consent for vaccination. So that might vary by practice. Some might want the parent there for consent, but other places will take it over the phone. But I think per our state laws, the child under the age of 18 requires parental consent for vaccination.
Great, thank you. And then we can actually take one more question. I'm sorry that we didn't get to everyone's questions today or follow-ups, but if we didn't get to your question, please go ahead and send those over to media_info@state.co.us. And Ellis, you are our last question.
Okay, can you guys hear me okay?
Yeah.
Awesome. All right. Yeah, this is Alice Arnold with Colorado Community Media Newspapers. Wanted to ask, since the state has dropped the COVID dial and most of the Denver metro area is expected to end local COVID dial restrictions after May 15th, does CDPHE expect that any restrictions on businesses and gatherings will need to return in the future, such as during this winter around the holidays if a fifth wave occurs?
I would say my focus is on the summer for another quiet, calm, no disease summer. In all honesty, a lot of the planning at CDPHE is really focused on the fall. We do expect there could be more cases rising in the fall. And so how do we maximize vaccination plan, vaccination work, get into communities? What can we do to best prepare businesses, schools, all the places that we live so that we're ready for the potential for a recurrence? Any decisions about having to use the dial, restrict businesses, will really depend on the experience of the fall, which is way too difficult to predict at this point, given that there are variants and other factors to consider.
Great, thank you. And I know we didn't get to everyone's first questions or some of the follow-up questions, but if you want to send those over to media_info@state.co.us. And we appreciate you joining us for today. And thank you to our subject matter experts as well as our interpreters. And I hope you guys have a great rest of your day. Thank you.